Hi everyone, I'm Dr. Justin Lin, here at Rehab and Revive Physical Therapy, where we rehab the mind and revive the body. Look, it's springtime, and it's my favorite time of the year because it's baseball season. We've got spring training underway, and the Major League ball players are headed into the ballparks and getting ready for a full season. Some of us may get thoracic outlet syndrome. What is it? That's just a hot topic. I think it's gonna happen more and more as we play different types of baseball over the years of our life. But I think it's a real serious problem that not a lot of trainers are thinking about, but we certainly can prevent it. So we're gonna find out what thoracic outlet syndrome is and why we're getting it. All right, so to help us explain what happens anatomically and why we get these weird symptoms that are called thoracic outlet syndrome, we've got our friend Albert. And what we need to know about Albert is, well, just a regular spine, but this is really important what happens. You can see that there's nerves that come out of your neck. Now, what you don't see here is a collarbone, but imagine that there's a collarbone right here. Now you can imagine these tubes or these nerves that go through, they travel. This is the area they call the thoracic outlet right here. And so you've got the collarbone, you've got your shoulder blade, and it basically clamps down. Now imagine what happens if these are kinked, pulled, snagged in these bony areas because your arm now goes right here. So you've got all this super interesting things that can basically break down and really be an impediment for things like gripping a ball. You just lose that feeling. There's numbness, there's pain, there's shooting electric things that really bother a lot of the pitchers. And this mostly happens to pitchers because they're throwing all the time.
That one right there is going to give it a run.
But it can happen to all different position players. But this is something to think about. So this is a lot of the reason, whatever it is that's happening, it's really impeding the nerves in this area. So we're gonna talk about the causes next. I think the number one thing to think about is we got unstable neck bones. Imagine, let's just use Albert as a reference again. You saw those nerves coming out of the neck. Now, if the neck bones are unstable, because some of you like to pop yourself, snap yourself, do all these funky stuff that really, you know, can really be scary. Is that these nerves get ticked off because they're just being, you know, jolted. Just imagine that. If someone's kicking your shin over and over and over again, how fun's that gonna be? So your nerves can take a lot, but over time it's gonna break down. So an unstable neck bone, that's something you gotta think about. That's kind of the root. That's where all those nerve roots come out. Next, you wanna think about the instability of that shoulder joint. We've talked about it at length for baseball players. Shoulders and shoulder blade and collarbone, super important. We want that to be stable. You want that nice fixed axis so you can whip the ball, and when you throw or when you swing or whatever, that's a really important thing. Now that leads us to our third thing, the faulty throwing mechanics. I love talking about all types of pitchers, but specifically we've had two players in the recent, I would say, last few years. Josh Beckett, who had to have surgery, remove his rib, and also Matt Harvey, who is the Dark Knight, you know, the Mets, Angels pitcher. He just hasn't found things again since he hurt himself. It's really important to understand that there's a reason why after that surgery he may have kept it up just a little bit, but then it started breaking down. It always breaks down. Never remove that first rib. Even if you got to change your mechanics before you remove that first rib. And then I talk about this at length as well. Bad habits, whether it's crossing your legs, sitting on the couch like this, you can imagine that, right? Being pinched. Driving with one arm, you know, on your steering wheel, that happens a lot. I had to suffer for many years until I actually realized I needed to change that habit. That really ticked off the nerves in my arms for so long. And of course, side sleeping. So these are the things that we really need to make adjustments. We've got a lot of habit videos on our channel, so please check those out. Sleeping, side sleeping, avoiding sleeping on your stomach, that's gonna be the key. So let's get you out of this funk and get you feeling better. So let's prepare to help you with that thoracic outlet syndrome. So you're gonna need two things. You're gonna need a yoga belt or a regular belt or even a long beach towel or a thin towel. And then you're gonna need a little hand towel for a different exercise. So let's get right to it. So the first thing is that first rib stretch. Remember, I said don't get a first rib surgery. They just gotta take that out. Now the key about that is that first rib actually pins those nerves down. They're supposed to. Once you take that away, there's no barrier, then the nerves are all loose and you can't send and fire that perfect leg tension. And there's also important neck muscles that are really important to that first rib. So don't take it out. You can do this instead. So there's two great angles that you can do for the first rib. So one is if I hold here, one is if I pull here and hold right across my ribs. So it looks a little bit like this. What I'm trying to do is stabilize here, pull like I'm grabbing a seatbelt and yanking it down. Now what I want to do is look up or down. Once I feel it tight, up is tight for me, then I want to look left and right, or right and left to you guys. So that feels restricted to me. And then all you have to do is say yes or say no. And no feels really tight. So it's 3 steps to this. Once again, let's look up or down, which way's tight, left and right, which way's tight, and then no or yes. And then you set that up. Now it's gonna be interesting because you might feel different things moving. You might even feel like a little angry nerve that's getting caught in your neck. Things may pop too, so don't force it, but if it happens, it just happens. So that's what it looks like. On the side, here's our view. Look up, down, left, right, and then yes or no. And so for me, it's just saying no to first rib surgeries. Don't do it. And it just got loose. So the second one, we'll do this on the other side, is to do a posterior translation or rotation of that rib. So you can basically hold it back, stabilize here, pull with this one. So I'm just holding here, and once again, same thing, up or down, down for me, left or right, right for me, and then yes or no. And yes is actually better for this one. So it looks like this. And you just do it till it feels good. Probably no more than 2 or 3 minutes, but yep, that's good. So it just feels a lot looser, which is good. So that's the first thing. You want to give it a little stretch, which is actually a mobility thing for those ribs. Now you want to stabilize it. So you grab the same thing that you were just using and you want to stabilize your neck. There's important muscles right back here. I like to level this out. There's upper, middle, which is middle of my neck, and lower, which is the base of your neck. So we want to hold it like this, upper, middle, and lower. Now with each angle change or each level change, upper kind of goes up about 5 degrees, middle is just kind of your straight plane, and then lower is down 5 degrees. So once again, upper, hold it. Now basically what I'm trying to do is I'm trying to jerk my head forward, but my head prevents it from doing that. So I'm just gonna hold it right here and sustain. Ideally it's about 90 seconds. And then you're gonna hold it here and sustain. Now if you find it kind of loose, that's an unstable neck joint. So for those of you who like to pop yourself, you're gonna hold it there. So, and then you're gonna hold it down here. This is a great exercise to stabilize that joint. Really cool, and really prevent that instability and those pinched nerves. So you're gonna hold that till you feel a little bit better. And then let's move on. So you got your whole shoulder motions predicated on a good shoulder blade, a good shoulder, and a good collarbone, clavicle is what we call it. So what we want to do is shoulder blade clocks. We've seen this many times in other videos. I'm going to say it again. If you want more in depth, check out these other videos. We have them more in depth. We're just going through these ones quickly. So you pretend there's a clock right in the middle. We're going to go 12 o'clock, 6 o'clock, 3 o'clock, 9 o'clock. My 9's a little off. But in a perfect world, if you can go 3 inches that way, you should be able to go 3 inches this way. So it's 12, 1, 2, 3, 4, 5, 6, 7, my 7's not that good. 8, 8's not good at all. I don't even know, it feels like 7. So in a perfect world, you want to be able to differentiate. So, and then, so 7, so 6, 7, 8, 9, 10, 11, 12. You go counterclockwise, 12, 11, 10, 10, 9, 8, 7. Man, this is awful. 8 and 7 are really bad for me right now. So 6, 5, 4, 3, 2, 1, and 12. So you're gonna see this is important. What does this mean basically in your whole throwing pattern? That my 7 and my 8, which since I'm a physical therapist, that needs to be stronger. It's that angle, 7 or 8. So it's an extension of where we're taking it. So if you are throwing, you're gonna need a lot of this at first. So you better have that range. Fortunately, I do, but I don't have this lower range for my own particular career and occupation. What you want to do after that is then you want to stabilize that shoulder. You want to get that suction in. We talked a little bit about the anatomy there. So you need this towel here. If you want, you could do a piece of paper, that works too. But the most important thing is I'm trying to prevent myself from pulling this out. I'm gonna hold it, I'm gonna pinch it, and ideally you're taking that shoulder head down and in towards my sternum or my chest bone. So I'm gonna hold that and hold. And ideally you're holding about 90 seconds. You shouldn't, like the goal is really to try to pull it out, and then the goal of this shoulder is to prevent that and hold it. So hold. You wanna hold, you're gonna hold, and hold. So let's test the other side. This is my true throwing side. I'm a right-handed thrower. And you can see that it's not, interesting enough, I have a little bit of tendonitis in my bicep, and I'm pulling this pretty easily. This one, snug, 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 like snuggies, snug. This one, I'm trying my best, and I'm only using my pec muscles, so I need to figure out, I don't have to pull that hard. If you're pulling it out like that, then you just slow it down. You don't pull that hard. So you just hold, and it looks like this. The angle's that way. And I want to stabilize this. So this is an exercise that's great for me. A lot of those that have the tendonitis in the shoulder and biceps and rotator cuff, also great exercise. So now it's a little better, and you can see that I'm doing a better job. Still moving, but need a little bit more work. And then the last one is a collarbone stabilizer. You need these little muscles right here, particularly the subclavius. Now this exercise targets subclavius, your rotator cuff group, and your rhomboids. So the whole goal is to really drive this down. So let's use my biceps issue area. Let's go ahead and hold that. So you want to pretend it's like on a shelf, like you're on a pool deck, and just like hanging out there, enjoying the sun. Like today, it's like 70 degrees here in sunny Southern California. Perfect, so just enjoying that, hanging out. So you're gonna use that, you're gonna press it down into your hand. My hand doesn't really do anything except post up against it. Keep my elbow narrow, drive this down, and you wanna trigger these 3 muscles. So that's the rhomboid, the rotator cuff, and the collarbone. Want to drive that down, and you're gonna hold it. You hold it till the shakiness stops, usually around 90 seconds. You're gonna find that as a theme. Once you get really good, then you can do this motion where you're clamping down like a clam or Pac-Man. Clamping down. So you drive that down, slowly bring it up. 4 seconds down, 4 seconds up. 4 seconds down, 4 seconds up. So there you have it. These are the great shoulder stability exercises to really avoid pinching those nerves and then getting yourself thoracic outlet syndrome. Hopefully you found that thoracic outlet syndrome super interesting. I hope many of you never get it in your lifetime, but if you do, make sure that these exercises are also the right ones for you. Check with your healthcare professional. I think they're great because it's all about stability. We need to stabilize your neck, your shoulder blade, your collarbone. These are the keys to the success to avoiding those nerves getting pissed off. Not just removing a first rib. I'm gonna tell you again, don't remove your first rib. It drives me like insane. Especially you major league ball players, just don't do it. Every single pitcher has had a career ender after this. They haven't been the same. They're awful. You know, they have no velocity. So we'll talk about that more on a different day. Anyways, hopefully you like what we're doing and you found this video and many of our other videos entertaining, because we'd love your support. Leave a like, subscribe, and check out all our fun DIY exercises for shoulder or neck, or even, you know, more things for the elbow. Yeah, and if you tried these exercises and you're in pain and you found them helpful or you didn't find them helpful, leave a comment. We'd love to improve our game here. So I'm Dr. Lin. Remember, we heal smarter, not harder.